New York's governor is set to end the state's stringent indoor mask mandates. This follows moves in the last week in New Jersey, Delaware, California, Connecticut, and Oregon. Joining us right now to talk more about it is Dr. Kavita Patel. She's a former White House health policy director, also an NBC and MSNBC medical contributor. And Dr. Patel, there are a lot of people who are kind of trying to figure out what this means. Is this being done because Omicron's really receding and we should feel better about how things stand from here on out?
Yeah, Becky, there's no doubt you can't dispute the facts. Not only is Omicron receding, but as you mentioned, the states you just cited, the majority of those states, especially in higher vaccinated areas, have positivity rates in the single digits. And that's good news. I think what's hard to reconcile is that, if you sit back, if you were to just drop in this moment in time, we had 15,000 deaths last week, an airborne virus that we know is highly infectious, and we're still seeing a number of unvaccinated people largely ending up in hospitals. And so I think honestly, that's the tension that we're trying to balance. Oh, add to that the therapeutics that you and I have spoken about earlier, more and more available, but still not very easy to get to and still very hard to navigate in the early days of infections.
So is this coming too soon as far as you're concerned?
So I don't think the conversation about when to lift them, because, for example, New Jersey, they didn't have it take effect immediately. They cited a date in the future. And I do think that it is very responsible for every governor, every local official to think about when these restrictions need to come off. I think what's happening right now is a chaos of confusion where you've got this, let it all off immediately kind of attitude. I think that is a mistake, especially when every single state is still showing. You look at the CDC map, Becky, every state is still showing red. Now, that is separate from what I think is very valid, where we're seeing people who they're not wearing the masks properly, social decline, especially in older kids. You hear this more in adolescents and older children, and they obviously have vaccines available to them. I think that's the balance. You have to think about your local community and the population, level of vaccination, level of case rates, and frankly, kind of what you're trading risks and benefits for.
That information is not easily available, just in terms of trying to see the case count in your local community, knowing what's going on. There were easier ways to track it early on in the pandemic. It's not so easy now, especially with home testing. So what would you do in your family? What would you tell your patients to do if the mask mandates come down? Still wear a mask, or there's going to be a point when you're the weird kid if you're still wearing the mask at school. How do you determine it? When to say yes, I'll do this because it's required medically, or maybe it's a safer thing to do, or when to say forget it. Socially, this is not what I want my kids to be doing.
Yeah, there's no doubt about it. If you told me there's a future where we're just wearing masks in perpetuity, I would call that ridiculous. The science doesn't even support that if we see that cases are coming down. So to your point, and by the way, I think that it's irresponsible. I'm going to try to reflect what working with pediatricians, child psychologists, this is kind of an interdisciplinary effort. Number one, you do need to get an accurate assessment of your community. If your schools or your county do not have a county dashboard, then that is the right time to look for some other way as a proxy, wastewater surveillance. We have a number of ways, even though the data collection, as you point out in some places, does not exist. We do still have a way to look at vaccination rates, uptake rates. That is available. I would add that data. And then for my own family, my kids are still wearing masks. But Becky, that's because I still have unvaccinated children and I have people around them that are unvaccinated. Right. And then number two, I think you also have to weigh your family's risks or dealing with what might happen. If I tell you there's a maybe 5 to 10% chance of longer term symptoms, I won't even label it long COVID because we still don't know what that looks like in pediatric populations. If there's that chance, but you're looking at your child and they're not socializing and they tell you, Mom, this mask is something that's not really helping me to play, then you take that into consideration. But Becky, I think my point, today is not that day. The planning for that needs to happen. And I've been asking schools, we've got the 2 to 4 year old vaccine, 6 months, sorry, to 4 year old vaccine, literally probably hitting shelves on February 21st. So we're not talking about months. We're talking about weeks.
Right.
And that will buy us the time.